Hello, I'm Patricia Henderson with Senior Connection Center, and this is your weekly connection. Joining me today is Sylvia Leddy, Program Manager, Diversity Initiatives with the Alzheimer's Association Florida Gulf Coast Chapter. Sylvia, thank you for joining me today.
Thank you, Patricia, for having me on.
Currently, there are more than 5 million Americans living with Alzheimer's disease, and more than 16 million Americans provide unpaid care for individuals with Alzheimer's disease or other forms of dementia. Being a caregiver can be a challenge throughout the year, but holidays can add another level of stress. Sylvia, what are some things that a caregiver could take into consideration or keep in mind during the holidays if they're caring for someone with Alzheimer's or another form of dementia?
That is a great question. And like you said, caregiving is hard anytime. But during the holidays are a special time for getting together with family and friends. But due to the ongoing COVID-19 pandemic, these gatherings may pose a heightened risk for spreading the virus, especially for older adults. The risk of becoming severely ill from COVID-19 is greater for individuals living with dementia who tend to be older and have underlying health conditions. So the safest option is to avoid in-person holiday gatherings with people outside of your household. But there's still other ways that you can stay socially connected. So, of course, we all want to celebrate while practicing social distance. And some of the things that you can do is you can continue your holiday traditions. Maybe you can drop off some favorite baked goods or a care package in a way that avoids close contact, maybe such as leaving the special delivery at the front door. You can also schedule your own holiday parade. Ask family members and friends to maybe schedule a drive by the older adult's home with homemade signs or festive decorations. Maybe you can also plan something outdoors. Plan an outdoor visit with hot chocolate and blankets. Go outside for a walk in the neighborhood. Enjoy the holiday lights and the decorations. But always remember to maintain at least 6 feet of distance between yourself and any person who's not a member of your household. Of course, we all have heard about the new way of connecting this year, which is through technology, like Zoom or Skype, video chats, video calls. If you're going to have a video chat, make sure that you kind of keep the number of people to a minimum. Sometimes it can be overstimulating to have different conversations going on, especially with somebody who's living with dementia. You can maybe schedule a time to watch a favorite holiday movie together. But of course, some seniors might be a little scared of technology. So if you cannot schedule any of these things, pick up the phone, make a phone call. Sometimes we can still stay connected via telephone. And you know that there's still going to be those people who are going to want to gather face to face. So if you're going to gather face to face, make sure that you do not attend or host a gathering if you have been or think you have been exposed to the COVID-19. You want to ask your attendees to avoid or limit the contact with others for 14 days prior to your gathering. Maybe you can even hold the event outside. You want to ask the invitees or attendees to wash or sanitize their hands regularly, wear masks, and of course, maintain the 6 feet of social distancing. And maybe you want to shorten the duration of the event or limit the amount of time. Older adults will be in attendance. You also want to make sure that you avoid hugging or handshakes or close contact of any time. So you want to just make sure that you limit the number of people at the event. Those are just some of the things that we can keep in mind. You always want to make sure that when you're planning any holiday, you consider what's going to be the most comfortable and enjoyable for the person living with dementia. Sticking to their normal routine as much as possible is going to help keep the celebrations from becoming disruptive or confusing.
So keeping things simple is better.
Yes, the simpler the better, especially today. Yes.
That's good information to take into consideration. During this holiday season, individuals may be interacting with an older loved one that they may not have communicated with since last holiday season, and they may notice some cognitive differences. What are some indicators or things to be aware of that may indicate that there is actually a problem?
That is a great question. There can be a number of changes that we notice from last year to this year that may need further investigation. If we notice things that are new or unusual or even different, let's take a look at that. Memory loss that disrupts daily life may be a symptom of Alzheimer's or other dementia. And as you know, Alzheimer's is a brain disease that causes slow decline in memory, thinking, and reasoning skills.
Mhm.
We at the Alzheimer's Association have a wonderful program and a list of the 10 warning signs and symptoms. If you notice any of them, don't ignore them. It's very important to schedule an appointment. It may not necessarily be Alzheimer's or other dementia. It may be something else that might be going on. Maybe, some side effects from medications or a vitamin deficiency. But there are those things that affect our activities of daily living. I'll go over some with you. Some things that you might notice might be new problems with words in speaking or writing. Sometimes somebody living with Alzheimer's may have trouble following or joining a conversation. They might stop in the middle of a conversation and might have no idea how to continue, or they continue to repeat themselves. They struggle. They may struggle with a certain word, and that's when they'll call it, give me that thingy, that thing. And so some of them may even use the wrong words. So that's something that you may notice. Something else would be misplacing things and losing the ability to retrace our steps. Now, we all have misplaced things. And if we just take a few minutes to sit and think and try to retrace our steps, most of us are pretty successful in remembering. But it's when they are unable to remember the steps. They may lose things and be unable to go back over those steps, or they may accuse others of stealing, especially as the disease progresses. And so it's this inability to retrace those steps, putting those things in unusual places. Then one of the other ones that we notice too is maybe you might have noticed a change in mood or personality. Individuals living with Alzheimer's may experience some of these changes. They become confused or suspicious, depressed, fearful, even anxious, and they may become easily upset at home with friends or when they're out of their comfort zone. So these are just some of the things, some of the signs and symptoms that there might be something going on, and it's time to maybe talk to your primary physician about. And for the complete list, anybody can just visit our website, which is full of useful information at alz.org. And this would be the 10 warning signs of Alzheimer's and other dementia.
We will have the Alzheimer's Association website link and phone number, as well as links and phone numbers for other resources at the end of the video. How can someone find out more information about Alzheimer's and other dementias?
Well, Patricia, a lot of people don't have the information they need or the access to this information. And no one should face Alzheimer's alone. We have a helpful website where you can browse helpful information and resources for those living with or caring for someone with Alzheimer's or other dementias. We have a schedule of classes and live webinars with helpful information. We also have a catalog of recorded programs which provide trusted information and are available to be seen at the caregiver's convenience. When your loved one is asleep and you have a few minutes, hop on and you can certainly join one of our programs. So again, I'm sure, Patricia, you will have our website at the end of today's video.
Absolutely. Now, prior to the pandemic, the Brain Bus went around to different events, health fairs and expos, and even the state fair to provide information to individuals. Now, the Brain Bus is parked, but it's gone virtual. Is that correct?
Yes, we were so excited to offer educational programs via our Brain Bus. And of course, due to all these changes, the Brain Bus has now become virtual. So we have two vehicles, a Brain Van and a Brain RV, who used to travel all over the state of Florida, targeting underserved and rural areas, providing training and education on early detection and awareness for everyone. In response to COVID-19 and recommendations by the CDC, the Brain Bus went virtual in April 2020. So stops usually occur now through virtual, telephonic, on-demand, and or in-person delivery. Of course, right now we cannot do the in-person delivery. And we provide a variety of information such as risk factors, the warning signs, the benefits of early detection, some of the steps to receive an accurate diagnosis. We also provide information on current research trends and best practices for caring for someone with the disease. And so we reach into diverse rural and urban communities as well as outreach to healthcare professionals via our Brain Bus.
That's wonderful. And I know that many people who were not able to come to events, even prior to the pandemic, are able to access that information online now. And one of the new programs is called Vital. Can you tell us more about that?
Yes, we are excited about this new program. This is actually Project Vital 3.0. And as you know, Patricia, social isolation and boredom are particular challenges for those living with Alzheimer's and or other dementias, as well as their caregivers. And having a way to provide purposeful and meaningful engagement by connecting with family friends, healthcare providers, and other vital caregivers means that you never need to go at it alone. So the Alzheimer's Association, along with the state of Florida, the Florida Department of Elder Affairs, and IN2L is excited to offer Project Vital at Home. And Vital stands for Virtual Inclusive Technology for All. And this is a new and innovative program that has been specially designed for those living with Alzheimer's disease or other dementia and are still living at home. Participants are going to be receiving a wealth of engagement opportunities with an IN2L tablet and have direct access to the Alzheimer's Association live and on-demand support and education programs. This is an easy tablet that's going to connect them with puzzles and games, movies, audiobooks, music, and more to promote purposeful engagement for those living with Alzheimer's disease or other dementia. The tablet also is going to provide ways for them to learn, relax, and have fun, as well as connect with others near and far through an easy video chat feature. So this is going to be an excellent way to help prevent restlessness, frequent napping, and even anxiousness. And so one of the key requirements for this is that the person must be living at home. The reason this is because this is Project 3.0. We have had two other projects in the past where some of these tablets were given to people residing in assisted living facilities. And so now we are going to be bringing these tablets to those living at home. So hopefully this is going to help those make a connection, not just with their caregivers, but with other people not living in their own household. So if you or anybody that you know might be interested in Project Vital at home, you can visit our website or learn more by calling our 24-hour helpline. And the number to our helpline is 800-272-3900.
And we will have that number for you at the end of the video. Sylvia, thank you so much for providing such great information. We are excited about promoting the Brain Bus and Project Vital 3.0. Great resources for individuals living with dementia and their caregivers. So thank you again for being here today.
Thank you, Patricia, for allowing me this opportunity to talk a little bit about what the Alzheimer's Association is doing. A lot of people, unfortunately, are not aware of what we provide. And of course, our vision is to have a world without Alzheimer's and other dementia. And so a lot of people don't even know that we have this 24-hour helpline that is available because, as you know, emergencies never happen Monday through Friday. They always happen in the evenings, on the weekend, and on holidays. And so this is a helpline that is a lifeline to caregivers. We have counselors that are always available to answer your calls, your questions, and information can be provided in over 200 languages. So please make sure that even if you have a question, if you need guidance, if you need a community resource, you can always call us.
Thank you. That's good to know. Again, if you have a loved one with dementia and you're a caregiver, please reach out to the Alzheimer's Association. I'm Patricia Henderson, and this is your Weekly Connection.